Hello everyone, my name is Zahraa and I have prepared this video for you about the interpretation of chest X-ray. So let's get started. So to begin with, before starting into the interpretation part, we need to first familiarize ourselves with what a normal chest X-ray looks like. So I have, you can pause the video now and label each number, and now I will put the answers. Alright, now we will start with our interpretation. So our first step and the most important step is to first make sure of the patient information, including the name, age, gender of the patient, as well as the medical number. And you should also be provided, ideally you should be provided with a brief history of the presenting complaint of the patient. Next, we will start by commenting on the film of the X-ray. So here we have a mnemonic that you can remember, which is the RIPE mnemonic. You will start first by commenting on the rotation, inspiration, projection, and exposure of the film of the X-ray. Starting by the rotation, you just need to check the distance between the medial heads of the clavicles in relation to the spinous processes of the vertebrae. It should be equal or nearly equal. So in this case, you can see that the heads of the clavicles and the medial heads and the spinous processes are equidistant, so we can say that there is no rotation. Moving on, we need to comment about the inspiration, and we can do this by counting the number of the ribs visible. So you can either count the ribs anteriorly, which appear to be floating in the X-ray, or you can count them the posterior ribs, which are the ones attached to the vertebral bodies. Now, ideally, there needs to be 5 to 6 visible anterior ribs. Likewise, for the posterior ribs, ideally 8 to 10 ribs should be visible. Moving on to the projection, we can have 3 options. It's either posterior-anterior projection or antero-posterior projection, and we also have the lateral projection. Next, we have the E, which is the exposure of the film of the X-ray, or it is more commonly known as the penetration. So this shows you you need to see how well is the X-ray penetrated into the patient. So you can tell this by seeing the vertebral bodies. They should be barely visible behind the heart shadow. So you can barely see the vertebral bodies and the intervertebral discs. In case they were very obviously visible, then that means that the film is over-penetrated. Likewise, if it was not visible at all, you can't tell any shadows, then that means it is under-penetrated. Finally, you should not forget to also comment about the orientation and the position. Orientation means that this is the left side of the patient and this should be the right side. This should be labeled in your film. And also the position, it is upright or erect, and it can also be supine in other cases. Now we can start on commenting about the A, B, C, D, E of the chest X-ray, or this is when we start looking systematically on the structures apparent in the X-ray. So what are the A, B, C, D, E? We start first with A, which is the airways. Most importantly and most clearly visible is the tracheal deviation. So you have to check if the trachea is aligned in the midline or if it's deviated. In case of deviation, it can indicate 2 things. Either it can be deviated to the opposite side, so that means if there is, for example, a pneumothorax in this side, then it will deviate the trachea to the opposite side. Or if this side is affected by fibrosis or lung collapse, then it will deviate the trachea towards it. Moving on, you also need to comment about the lung field along with the apex of each lung and check if there is any consolidations or any masses. And you also need to comment about the pleura of the lung and the hilar region. Next is B, which is bones. This is where you comment on the clavicle and, very importantly, the ribs, if there is any fracture or any abnormalities. Next is C, which is circulation. Here you look at the heart and the associated structures. The heart size is where you use your cardiothoracic ratio, which is basically the ratio of the size of the heart from each border to the outer margins of the thorax, and this should be less than 50%. If it is more, then this can indicate cardiomegaly. And also the aortic knuckle, you should also comment on it. It should be visible along with the position and borders of the heart. D stands for the diaphragm, which is also visible in the chest X-ray, and it can indicate pathologies if there was any abnormalities in the position. You need to note that normally the diaphragm is elevated on the right side due to the presence of the liver. Finally, E stands for the extra soft tissue that you can see outside, aside from the stuff that you have already mentioned. So this gives you the freedom to comment on either soft tissue or any lesion that you forgot to mention while commenting on these stuff. Now we can compile all this and apply it in a case scenario that we can see here. So we need to start first by mentioning the name of the patient, patient ID, age of the film, and everything, orientation and all. And next we will move to the rotation. So we can see that the distance between the spinous process and the medial head of each clavicle is equal both sides, so there is no rotation. Next, for the inspiration, we will check the number of the ribs. I will count the anterior ribs. So I will start 1, 2, 3, 4, 5, 6, 7, and 8. So we can see that more than 7 anterior ribs are present, which indicates hyperinflation of the lungs. For the projection, it should also be mentioned here. I believe it's posterior-anterior projection. And the exposure or the penetration, we can see that there is adequate penetration of the X-ray film, as we can barely see the vertebral body shadows. Now we will comment on the airway. So we'll start first by the trachea. We can see that it is in the midline. As for the lung fields, we can see that there is hyperlucency in the lung fields. It appears darker than usual, and we can also see that the diaphragm it lost its original dome shape, and we can see that it is slightly more flattened. And as we commented earlier, there is a hyperinflation of the lungs. As for the bones, we can see that the clavicles appear normal, as well as the scapula, they are in their proper position. Moving on to the circulation, which is where we comment on the heart, we can see that the transverse diameter of the heart is narrower than usual. And we can also see that there is an increase in the vascular markings of each hilum of the lung. So this can lead us to predict a diagnosis of COPD. Of course, we need to match it with the presenting complaint of the patient. So here I will attach a normal chest X-ray, and just so we can compare between the different pathologies that we can see in this X-ray. So this is it for my video. I hope you benefited from it, and I hope it was a good revision for you. And thank you very much for watching.